Hello, welcome back to the continuation of our video lecture on primary healthcare. And this time we are in our second um, healthcare service or program, which is locally endemic diseases control. And this is focused on the Philippines. And as we all know, um, when we say endemic, it is referring to number of cases which are usually I'm referring to diseases which are usually constant in nature, constantly happening, constantly having cases in a locality in a certain period of time, or let's say in a year. And these are handpicked. These are I think diseases which are really common in our places, and we'll have a run through of this discussion. And I advise that you still read your textbooks, you still listen to your teachers who are considered to be experts also. And I suggest that you also read or search and read the content of the Department of Health website for updating purposes. And in my case, in this video lecture, whenever there are new or updates, we are going to create another video lecture for it for the purpose of updating the contents. But there are some viewers also who try to compare programs from the old one to the present one, or the updated programs. So it's up to you if you want to watch later the older versions, or older versions of the programs. So let's start. So first is we have the malaria control program. Before I go further with this program, I just would like to give a short introduction about malaria. This topic will also have a different discussion on communicable diseases. So let's just give this topic an introduction. So when we say malaria, it is a infectious disease which is usually carried by a mosquito. Based on your readings later on, it will be one of the most common carriers, the Anopheles mosquito, female Anopheles mosquito. And it is the causative agent is a plasmodium, okay, which usually is being familiarized by four strains. We have your Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and Plasmodium malariae. And considering the four, uh, falciparum is the um, let's say what's the most fatal one, okay. And for the content of malaria, the diagnostic procedure is usually a blood smear. Okay, other textbooks refer it to as blood smear malarial parasite. So they are going to get blood samples from a patient suspected to have malaria, and they will study the sample under a microscope. Um, of course, under microscope, they will see, okay, the plasmodium, and this plasmodium usually destroys the red blood cells. Later on, we'll have a comparison with dengue, and once this dengue control program will be presented. And what else? This malaria has manifestations that is usually based on stages. And one is we have the hot stage, which is characterized by fever. We have the cold stage characterized by chilling, and also diaphoresis, characterized by wet stage characterized by diaphoresis. And this is usually cyclical, and that is one of the manifestations that can put a person suspect of malaria. And for the diagnosis or studying the case will also um, assist, will introduce the healthcare provider to a splenomegaly case or the enlargement of the spleen. And what else? For the Anopheles mosquito, um, it is usually night biting. It is usually a night biting mosquito, a high flying mosquito, and usually thrives on running water or flowing water. And other references would say it's usually common on rural areas. In our case here in the Philippines and other tropical areas, it's usually seen on forested areas, forest, and mountainous areas or places near the river. Okay, so those are usually the possible breeding sites of these mosquitoes. And again, the mosquito is not the one causing the disease. It is only a carrier. It's a vector. The one causing the disease is the plasmodium. Okay, only infected Anopheles mosquito. Okay, not all Anopheles mosquito has the disease or the causative agent. Only infected female Anopheles mosquito. Okay, so I will continue on my discussion on malaria as we go on. Okay, so malaria control program is a one of the endemic programs or control programs of the Department of Health. It has a vision of a malaria-free Philippines, and the mission of this program to reach a malaria-free Philippines is to empower health workers. That includes us, nurses, and other frontliners, health workers in the community, the population at risk, meaning those people who can have malaria, and all others concerned to eliminate malaria in the country. And the goal of which is to significantly reduce malaria burden so that it will no longer affect the socioeconomic development of individuals and families in the endemic areas. So as you can understand or observe in the statement, it focuses on the burden the burden brought by malaria, not only physically, mentally, or emotionally, but also the socioeconomic aspect of a family, of a person, or the larger community. Because as seen by the department, the ones who are usually having the cases are poor families. So considering that they are poor, they live below the average salary, uh, having malaria will add up to their financial constraints, their financial burden, financial problems. So that conceptualizes everything, reasons out why this vision, mission, and the goal is presented to us. Um, in the Since this is endemic in a local or in an area, there's possibility that there would be epidemic. So as you all know, when you say epidemic, it differs from endemic. In case that in cases that the number of these diseases may rise, like it may rise abnormally or unusefully from the constant number that the disease um, is present or that is present in the local. So in the event that there is an epidemic, there will be collection of mass blood smear. Okay, so a lot of people or a number, several people will be asked to submit samples of their blood. Then, of course, once samples are collected, they are going to be studied, and confirmation of possible malaria is to be made, and follow up is to be made also. And further, um, this is the most important part here on this program is the preventive aspect of it. How do we prevent malaria from happening so we can reach this vision of a malaria-free Philippines? Okay? So, what are the objectives of this program? This is to ensure universal access to reliable diagnosis, highly effective and appropriate treatment, and preventive measures. So, first, access to reliable diagnosis. I've mentioned already the diagnosis considered in our references. In our reference, it is BSMP or blood smear, malarial parasite, or blood smear in other references. Getting samples, studying it under microscope, looking into the microscope if there's presence of the causative agent. Okay, so um, appropriate treatment as we have this anti-protozoal, specifically anti-malarial drugs. Um, Examples are your quinine, chloroquine as antimalarial drugs, and these are used with caution. This really need to be prescribed by a physician, especially if you're a pregnant client, pregnant woman who is living in an endemic place who is suspected of malaria, because these drugs are usually are teratogenic. Okay, so we'll deal this more later on our communicable diseases video lectures. What else? When you say also treatment, um, it is, aside from the medication, it's a supportive one. Whatever the manifestations are, this can be treated by some interventions. Okay. Then preventive measures. Preventive measures in summary, based on our references, um, it is acronym into the word clean, CLEAN. Okay, C stands for chemically treated mosquito nets. I'm not sure. I don't know if you have seen a chemically treated mosquito net, usually provided by the rural health units. I'm not sure if it's pink or blue pack one and handed per household. Larvae, letter L, larvae eating fish. So fish which eats larva, as the term implies. A larva mosquito, for example, um, a pond with fish, since or river. You can put up a pond which a mosquito can lay their eggs or larvae, then the fish will eat the larva. Aside from that, we have your zooprophylaxis. So larvae eating fish and zooprophylaxis, having domesticated animals in your surroundings, as instead of the mosquitoes coming for you, they will go to these animals. Then letter E, environmental sanitation or environmental cleanup. You are going to clean, destroy possible breeding places of the mosquitoes, except obviously for if the breeding places are forest, you don't have to destroy the trees. If the river is the breeding place, you don't have to do it also. So just look for another means to do it. Then letter A, anti-mosquito soap. And letter N, neem tree. I'm not sure if you have seen this plant, this tree, in your own place. If you haven't, you can just Google it up. Okay, so because this plant is believed to have um, a mosquito repellent property. Okay, the number two of the objectives, we have capacity local government units to own, manage, and sustain the malaria program in their respective localities. Okay, so this is to empower your local government units, basically the provincial level and the municipal level. So they are being authorized, they are being empowered, they are being tasked to run, to manage their own malaria control program, because The central office, DOH, cannot do it alone for the whole Philippines. The powers, the responsibilities were shared to them. And number three, sustain financing of anti-malaria efforts at all levels of operation. So this comes with finances, budgets, resources, about money. Okay. And fourth, ensure functioning of a quality assurance system for malaria operations. So this one gives the people assurance, especially if you're in an endemic place, of a system that would tackle problems on malaria, okay, of quality. This to be, when you say quality assurance, from those terms, assured quality, assured healthcare services, assured quality healthcare service towards the problem malaria in these endemic places, from from uh, assessment down to planning, to interventions, to evaluation of patients until the patient gets well. Okay? So, who are the beneficiaries of this program? Okay, so we have the poor municipalities in endemic provinces, uh, those who are near the breeding areas, example, the mountainous forested areas, rivers, and farmers relying on forest products, indigenous people with limited access to quality healthcare services, then community affected by armed conflicts. This armed group usually lives in this type of communities, right? Mountainous, forested, and um, um, usually those people who are living there peacefully will be relocated to other places, so they can be in an endemic place also. Then pregnant women, as I mentioned, um, of pregnant women of endemic place, they should be monitored also. They should be given extra care because malaria is a fatal disease, okay, and can affect not only the mother but also the growing fetus or soon to be infant. Then children aged 5 years old and below, so or the under five children. This is emphasized because according to WHO statistics, this age bracket is very prone to mortality and morbidity. Okay, so as young as they are, they need to be given extra care also. Then, what are the possible program strategies, interventions of this program, okay, with its key partners? Uh, DOH plus the LGU plus other agencies plus private entities as an example. Okay, so we have summarized into three based on the site. Also, we have program strategy number one, early diagnosis and prompt treatment. This is very important because time is of the essence. When a patient goes for or is having a problem, and we're in, he or she is living in an endemic place and he or she suspects malaria, time is of the essence. She or he should go for medical advice or checkup. Okay, and prompt treatment, prompt intervention should be done. Okay, and this one gives the principle of having diagnostic centers in a certain locality. Okay, so there are malaria control rehabilitations, malaria control facilities in a certain place. Okay. So diagnostic centers were established and strengthened to achieve this strategy. The utilization of these diagnostic centers is promoted to sustain its functionality. The number two, vector control. So how do we manage the presence of these vectors, of these carriers, the mosquitoes, okay, I have mentioned the one is the clean technique. Okay, and it is stated here in the presentation that the use of insecticide treated mosquito nets, complemented with indoor residual spraying, prevents malaria transmission. Okay, so that's how we control the vector. Not to destroy the environment. Number three, enhancement of local capacity. LGUs are capacitated to manage and implement community-based malaria control through social mobilization. So the local government units should also seek the active participation of their constituents, of the towns, of the barangays they are covering. So social mobilization, people empowerment is key on our partnership with people is a very important key on the success of this program, as also stated in our primary healthcare principles. Okay, so these are just some of the strategies that can be implemented. So just to have a idea of malaria in terms of the signs and symptoms, persons with malaria may experience chills, but of course it happens with fever first, then chilling, then diaphoresis, then fever. It's cyclical. Okay, it's cyclical. And in terms of BSMP or the blood smear malaria parasite, I mentioned that it is the diagnostic procedure and when is the best time to take blood samples. If you're in the hospital or you're in maybe a keen observer, based on our reference, the best time to take samples of blood is when the patient is on the height of the fever or on the peak of the fever. Okay, so that's the best time to get blood samples. That's the time that the plasmodium is considered to be active. Okay, so manifestations are chills, sweating, dry cough, enlargement of the spleen in relation to blood. That's why it's enlarged, and in your anatomy, the function of spleen is emphasized there. And stomach, in relation to GI, the patient experiences nausea, vomiting, back pains, fatigue, bone and muscle pains are usually present, fever, this high grade fever, and also headache. And as I mentioned, malaria is to be taken seriously because this is also fatal. Okay, so that is our malaria control program in the Philippines. Thank you. And our next control program is about filariasis. Thank you.